To end hunger, we must improve the lives of mothers and children. Since 2000, we have succeeded in reducing preventable maternal and child deaths by 50%, thanks in large part to early intervention and improved nutrition. Zambia, one of the many countries around the globe working to ensure mothers and children survive and thrive, offers us insights to the challenges that remain and how they can be overcome.
So in order to reduce the maternal mortality rate, we have about 11 outreaches, and the furthest is about 23 kilometers.
Today we are coming for maternal and child health.
If possible, we're able to detect if there's any problem in the pregnancy so that we refer them to the hospital.
The 95-bed Chakani Mission Hospital serves the residents of 180 Zambian villages and is supported by partnerships with churches and foundations. Like Zambia, dozens of other countries have developed their own plans to expand effective nutrition programs to children at risk of malnutrition. They have come together in a movement called Scaling Up Nutrition. Through these local and global partnerships, mothers and children are surviving and thriving, and their death rates have been drastically cut.
Last year we had about 514 deliveries, and the maternal death rate was 0%.
The hospital staff is also working hard to overcome the hurdles facing infants and children in a developing country.
For the under 5 children, we are basically doing growth monitoring, and those that were due for vaccines, we're giving them vaccines.
As we improve healthcare, we must also improve access to nutritious food. To keep a body healthy, nutritious food is essential. However, too many families around the globe do not have the resources to provide their children with a nutritious diet. A diet that would allow children to develop and flourish.
The people in the villages, they can't afford to buy anything.
Most rural families are subsistence farmers, and there's often a gap between their food supply and their next harvest. With farming as their primary food source, many families also lack foods rich in micronutrients. And without a diversified diet, children become more susceptible to illness and malnutrition.
We have a lot of malnutrition in the season where the food levels are low.
The U.S. donates nutritional supplements to countries in need around the globe, saving many lives on the edge of malnutrition. While there is still a need for these life-saving supplements, early prevention and other health programs are drastically reducing severe malnutrition around the globe. Improving mother and child nutrition is a sure step to ending hunger around the world.
If we tackle malnutrition at ground level, maybe things may change.
As a global community, we have made great progress toward ending preventable maternal and infant mortality rates, in large part through better nutrition. However, too many lives still teeter between a preventable death or the opportunity of life. We have the proven knowledge to end this problem, and improving mother and child nutrition is the key. The outcome will be greatly affected by the political decisions we and our leaders make today. It also depends on whether we push to continue and accelerate the progress that is being made against hunger.